Today, we're going to be talking about kind of the early stages of parenting and pregnancy. And Sandra is the person I want to hear from on this topic as well. She's the director of the Center for Perinatal and Reproductive Mental Health at Minnesota Mental Health Clinics. I'm Lindsay, by the way. I'm the senior director of marketing. And so I'm going to just kick it off and then I'll hand it over and you can hear from the expert on this. Sandra has over a decade of experience supporting individuals through pregnancy, loss, early parenthood. She's passionate about helping people feel less alone in what they're experiencing and is committed to providing compassionate, inclusive care that meets people where they are. So wherever you are in your journey, whether you're a provider, a community member, somebody who's expecting, maybe you just had a new baby, you're in the right place and we're so glad you're here. So with that, I will hand it over to Sandra.
Awesome. Welcome, everybody. I'm so glad that you're here, whether you're live with us or watching this after we've recorded. We're talking about perinatal mental health and kind of the basics of what that is. A lot of people have lots of questions and have heard things, and I know there's lots of messaging on social media, so I thought it could be helpful just to give us a little bit of space to get some clarity on what is the most common experiences or mental health challenges, how to identify them, what to do about it. I've got lots of resources in here towards the end, so make sure that you stay for that part and grab some screenshots, or I've got QR codes for you to see too. All right. Did that change slides? Is it working right, everybody? Okay, this is me. Lindsay just did a great job introducing me. I'm a PMHC, which is a perinatal mental health certified, and LPCC. I'm also a parent. I have 3 kids, and I've had a loss myself as well. So our agenda for today, we're going to talk a little bit about why this feels so hard for most of us, what are PMADs, which is like shorthand for perinatal mood and anxiety disorders, what helps when we're experiencing those, some resources. And I have discussion as Q&A in here. I want to make sure that you are welcome to like throw things in the chat. Lindsay, you can see the chat, right? Because I can't see it when I have this screen up.
I sure can. Yeah, I will monitor the chat. You can either drop questions in the chat or in there's a little question module as well, and I can monitor those. I don't know if participants can unmute and talk, but if so, you're also welcome to do it today. It's a small enough group that I feel like it wouldn't be disruptive and it would just add to the conversation. So feel free to, join the conversation if that's a setting you have.
Absolutely, if we can do that. All right, things I want everybody to take away from today. Pregnancy and postpartum is a hard experience. Struggling is a lot more common than most of us think. And most importantly, everything is treatable. Moms get better, parents get better when they get support. And we see that over and over and over again, both in my clinical experience and in all the data. So if you get nothing else from today, I want you to walk away with that. So what percentage of women with a diagnosable mental health disorder at their first follow-up appointment do you think could get treatment for perinatal mood and anxiety disorder? So how many moms are going to that 6-week follow-up and are already struggling that you think get treatment for that? You can take a guess, and then I'm going to share it with you. It's only a third. Only a third of us. So a lot of us aren't getting the support that we need. It feels really hard. Generally in the States, this is kind of what the perinatal mental health overview is. About 1 in 5 birthing people meet criteria for a PMADs. Postpartum depression has doubled between 2010 and 2021. So more of us are struggling. That's not in our imaginations. Maternal depression can show up anytime during the perinatal period. This is kind of the breakdown. About 40% start during postpartum, about 33% start during pregnancy, and about 26% start before pregnancy, especially for those who are going through fertility treatments or challenges in becoming pregnant. People of color are increased risks for maternal mental health disorders. 40% of Black and Latina moms have PPD, twice the rate of their white counterparts, and they're also less likely to start treatment for maternal depression than white women. Lots of reasons for that. Here's an interesting one that I didn't know until I was reading some of this stuff, is that Gen Z is more than twice as likely as boomers to suffer from a mental health disorder. So again, it's feeling harder for all of us. This is Minnesota's specific grade about maternal mental health. The national average is C minus. So we're doing better than the national average. We have a C. And it all went up a little bit. So in 2024, it was a D plus. So we're going the right direction. It's just slow moving. So what are some of the things that get in the way of us getting care? What's hard about getting that support? Stigma is still a problem, right? Lots of families, lots of particular cultures struggle to identify good expectations about what postpartum and pregnancy can be like, and getting mental health support is not normalized in a lot of places. A lot of obstetric training is missing mental health pieces. So they're specialized in what they do in caring for pregnant people, and they don't have a lot of great training on mental health. And so there can be a big gap there, even if they want to be helpful. There aren't great resources. So there's big disconnection between seeing your OB and seeing your pediatrician and then finding mental health support, right? We're not all talking to each other. And so you can kind of get lost in that shuffle. There's also what we call maternal mental health deserts. This is a lot more in rural areas, but definitely in red states where there's less OB care overall. And there's just no perinatal mental health provider to get to, even if you want to. A lot of times we're minimizing symptoms. So, oh, this just must be what it feels like. Suffering is what postpartum feels like and what motherhood is. We have a lot of beliefs about what that should feel like. And we just kind of normalize it. Sometimes, especially we'll talk about this when we get to the anxiety part, but sometimes we even get praised for having symptoms, right? We're like super anxious about baby's well-being and we're monitoring everything. And people are like, oh, you're such a good mom. We're normalizing what's actually a lot of distress. And sometimes we just think it'll get better. I'm just going to ride it out. I'm going to feel better. And then it just doesn't. But in the meantime, we haven't gone to find some help. So the things that help people get care are feeling really validated. So whether if you're someone who's supporting a parent or a pregnant person, validating that what they're experiencing is really hard is a big part of helping them get support. Better training, like we talked about. Better screening. And we're working hard on this in Minnesota, and Minnesota Mental Health is working hard on improving screening so that when you're at the doctor's office or you're at that pediatrician appointment, you're getting a screener that can help identify if you could use some extra support. Better outreach and follow-up. A lot of times I know people turn in those screeners and then there's no follow-up to that. That's not because providers don't care. It's because it gets lost in all the paperwork and all the shuffle. Having better education for providers, but also like communities, places where you might be getting support already, like ECFE, early child education, Head Start, all these places. Having more education about what to look for parents who might be struggling is a big piece that helps. And then already having established support. So support is the first intervention, and that's community and partner and family. And when we get a good support network that's wide and deep, then that's the first way we see symptoms start to improve. So if you already have some of those good relationships, you're more likely to be able to get care, reach out for it, and find it. I included this quote from a client of mine that gave me permission to share. So it's kind of long. You can go ahead and read through it if you want to. This was her experience postpartum trying to find help and support. And I thought it was really interesting, and it's really common that I hear these kinds of things. Like, we have the stereotype that motherhood is the best experience. And so when wasn't feeling that, I felt like I was just not doing a good job. And this is why I called it "you're not failing," right? We often internalize that and blame ourselves for that feeling like, oh, this is supposed to feel great. If it doesn't, it's probably because I'm doing something wrong. I guess this is what motherhood should feel like. That was the question that she was thinking. I'll give you one more second to look at that if you want to read that. All right. How we think about what causes perinatal mood and anxiety disorders, we use the biopsychosocial model, which just means it's a combination of things. It's genes and nutrition. It's psychological factors like emotions, behaviors, psychological history. If we have a history of mental health concerns, and then it's social. There's stress, there's the environment that we're in our home, the environment that we're in our town, in our state, and in the country. All of those things impact our risk level for suffering a little bit more during pregnancy or postpartum. All right, so let's talk about what we mean when we're talking about perinatal mood and anxiety disorders. Perinatal depression is the most common thing. People will often just say, I had postpartum, right? And they really mean postpartum depression. I think that's what most of us are the most familiar with. Perinatal anxiety. Oh, and we say perinatal because we mean like through pregnancy and postpartum. I don't know if I said that before. Perinatal OCD, which is obsessive compulsive disorder, perinatal trauma, and then perinatal psychosis, which is the one that everybody feels the most scared of. That's the one where they're in the news and horrible things have happened. And we will talk about what the risks are for all of these and what to look for. Starting with depression. The most common onset for postpartum depression is between 4 and 8 weeks postpartum, but it does sometimes show up much later. It's not the baby blues. The baby blues is very common and happens in the first like 2 to 3 weeks postpartum when you're going through a major hormonal shift. There's lots of emotions that come up, and that's very, very common and normal. It's after that when it keeps going and you're experiencing not just feeling a lot of emotions, but a lot of self-doubt, sometimes irritability and rage, things that you used to enjoy, you don't enjoy at all. You feel like it's maybe hard to bond with baby. Your appetite has changed. Sleep is different, and not just because baby's not sleeping. Even when they're sleeping, you have a hard time falling asleep. A lot of feelings of guilt show up here too. This is about 14% of folks who go through pregnancy and postpartum. Bipolar is part of depression. That's when you move between mania and depression. So you're going through like big shifts. And when you're in that more manic or hypomanic state, you often don't need any sleep. You start to feel a lot more alert and maybe over alert or agitated, often a lot more impulsive, can have really big, grandiose thinking, often can even go into hallucinations or paranoia. And there's an overlapping risk with the bipolar and the psychosis, which we'll talk about in a little bit. This is a really small percentage of folks, though. It's only about 3%. And a lot of times this is an underlying disorder that just hasn't shown up yet. Maybe they thought they had depression before, and now that we've gone and had a baby and made this huge change in our body, all of a sudden the other pieces of this mental health condition show up. Perinatal anxiety, I think I see even more than depression, even though statistically it's a little bit less. I think they happen a lot together. This looks like what you probably think it looks like. Lots of uncontrollable worry, a lot of hypervigilance, which is just the word for feeling really alert. And that's when I was talking about a few minutes ago, like checking on baby all the time, feeling like I have to see if their baby is still sleeping, or obsessively keeping track of when like they're eating, what their diapers look like, when they're sleeping, feeling really easily overstimulated, which I think a lot of us can relate to. And like I said before, sometimes this gets praised, right? In the most popular parenting style in America is intensive parenting for the last like 10 years or so. And that is really involved, really present, has a high pressure on parents and a high expectation. And intensive parenting styles actually increase depression and anxiety in parents without any better outcomes for kids. But we're kind of swimming in it. So we have these high expectations for ourselves that can cause us to feel really anxious. This can also be tricky to differentiate between ADHD or OCD or even trauma symptoms. So this is why it's helpful to go talk to a specialist who knows a lot about these conditions around pregnancy and postpartum. They can help you sort through like, what's your history? Are there other symptoms that just showed up now, or has this always been with you? You know, how severe is it? All of that. And this is about 6 to 8% of childbearing folks. Although, like I said, I think I see this more in my office than depression even. Perinatal OCD is obsessive compulsive disorder. And I know we use this a lot, right? Like we joke about, oh, I was just so OCD about that. But when it's really OCD, it is really intense. And it comes with what we call intrusive thoughts, which can be, are often very vivid and very scary, and feel very sticky, right? Like they don't want to go away. And in order to try and get them to go away, we start to develop these little rituals to make us feel safe. And that could be something as small as like locking the door 3 times, or as big as not being able to leave the house because I have 3 hours of things I have to do to make sure I feel safe enough to do that. And now I can't get anywhere because it takes up so much of my time. A lot of times these intrusive thoughts sound like I'm afraid I'm going to drop the baby down the stairs, and I have like a picture that I'm doing that in my mind, or getting in a car accident, or other really big, scary things that feel very real when they're in our minds. And then we do what we can to try and stop feeling so scared. We get stuck in this, like having to do these little rituals to try and feel better. During perinatal time, this is often focused on baby safety. And then there's a typo here. We're supposed to say ego dystonic, which is different from ego systonic, which is like it's consistent, right, with how I see myself. So when you're having OCD, and people ask this question a lot, like, how do I know it's not like into psychosis where I'm, I'm having delusions? And the big difference is that if you're having OCD, you are distressed by it. It upsets you to have those thoughts. And when we've dipped over into psychosis, often we feel like this is true. This is just happening. And that can be really reassuring if we are having these kind of intrusive thoughts, that it's actually a good thing that it upsets you, right? And we can work with that. This is about 4% of people who have babies. Perinatal trauma. I know folks often think about this as related to birth trauma, which it absolutely can be, and that happens. In part because when we go through a scary birth experience, a lot of times it's very minimized by the people around us, especially if we all come out alive. And that can make those feelings get really stuck. And this can feel like numbness or a lot of sadness. This time, the intrusive thoughts are often memories, like little flashes of things coming back, feeling on guard all the time, starting to do things where we avoid reminders of the traumatic experience. Like maybe I change clinics because I don't want to see that doctor anymore, or I don't want to go to that same place where I have to park. It automatically brings it back. It can be very isolating. So often people will kind of pull back, especially if the people around them are really encouraging and saying, oh no, this was fine. Everybody's good. You should just be so grateful. If we have an experience of trauma before pregnancy and birth, that can cause complex trauma. It compounds on itself, especially if it wasn't treated. And even if we don't have a scary birth experience, sometimes just this big change can bring those things back up. It often feels very disconnecting from yourself, right? So what I mean by that is it feels hard to tune in, right? We start to kind of separate from our body a little bit, and we can have a hard time noticing how we're feeling, or have a hard time knowing what we need, hard time connecting to the people around us, because we had to kind of disconnect from ourselves to get through that traumatic thing. And now it feels hard to come back together, if that makes sense. I feel like I'm going through this really fast because I can't see anybody. So I'm not asking anybody questions. Everybody who's in here with me?
Yeah, I'm still seeing you. Looking good. Pacing feels nice.
Okay. I know I talk fast sometimes too. That's the New Jersey in me. So tell me to slow down if I'm going too quick.
No, I think you're all good.
All right. Okay, this is the big scary one, but we should name it. It is so rare. I want to start there. It's like 1 to 2 women per 1,000 births. It's extremely rare, but it is a medical emergency. Perinatal psychosis is an episode of psychosis. It usually starts within 2 weeks postpartum. It's extremely rare for it to just appear months later, unlike depression or anxiety, which can kind of creep up months later. This is where the thoughts are egocentric, right? So this is like, instead of saying, oh, I had this thought that I was going to drop the baby, we start saying things like, I did drop the baby. I am going to drop the baby. I should drop the baby maybe, because the baby's not safe unless I do that harmful thing. It comes on very quickly. So this isn't something that kind of creeps up really slowly and we're not sure. It's like one day or the next day, all of a sudden, all of these things are present. And that can be really jarring for everybody, for mom, for the family. And you do really disconnect from reality with psychosis. So this is the time when you hear people saying things that don't really make sense. It can feel really scary. They might be hallucinating things about baby. Again, it's really focused on baby usually at this time. So lots of things about protecting the baby. Sometimes there's a religious component where it starts to be about like protecting baby from something spiritual that nobody can see, that they feel like is a threat. That's a really common one that comes up when we do see psychosis. This is also really treatable. It's a medical emergency, but if we can get people in to care, they get better. And I've seen that happen on the rare occasions when I've seen folks suffer with this, with the right medication and the right support. They go through this and it's just an episode. It's not something that now is going to come back later. It's just something that for whatever reason they were at risk for with their genes and the environment and whatever happened hormonally for them during that pregnancy and postpartum. Are there any questions about that? I know that's the one that often feels scary.
I'm not seeing any questions in the chat, but if there are questions from the group, feel free to chime in.
Okay.
But yeah, and of course, if you have, think of something later, you can always pop it in and we can discuss it towards the end as well. No, that does sound really scary though.
It is really scary. It's scary for everybody. I think going through it too, moms are like, what is going on? Right? Like they know that they're not feeling okay. But it's,
is this typically like a call 911 situation or, what,
Yes, it is. Yep. This is the scary news headlines when moms do things that harm themselves or other babies. It is most often from this. So it's not subtle, right? Like, you see it happening. So that's the good news. It's not something that feels kind of gray and confusing. Like, I don't know if this is happening or not. It's pretty clear it's happening, and it is a get to the hospital situation. We need to get medication and stabilization right away. And thankfully, here we have a couple of mental health emergency places, and I know HCMC has, we'll treat that. We'll treat psychosis, maternal psychosis, and then they can step them down to Red Leaf. And we'll talk about this in a minute with the resources. They can step it down to the partial hospitalization program that's specifically for maternal mental health, and then step down care from there. And I've worked with moms who've gone through this whole process. But again, it's very rare. I feel like I need to focus to remind people that it's very rare. Most of you probably not know somebody that goes through this. Okay, now we talked about all of the scary things that can happen and how often they happen. Let's talk about what helps. So this is the components of health and wellness for parents. This is from the Maternal Mental Health Leadership Alliance. And I love this little graphic because it's so clear. So I grabbed it from their website. But this is a collection of the evidence-based support that we know is effective for perinatal mood and anxiety disorders. Having time off from work. And we're lucky enough in Minnesota to have paid family leave now that a lot of states don't have. So that's great for us. Yay. So taking off as much time as you can. I always encourage parents to do this. I know sometimes we'll think, well, maybe I will only take a little bit and I'll go back. And I just encourage everybody to take as much time as they can financially afford to do. Medication. We have good research on medication for perinatal mental health. And I know that there's been some messaging from the health department at the federal level lately about risks for taking SSRIs, especially during pregnancy and postpartum. But we actually have great evidence, great research on this that says that a couple of them are really safe, and a good prescriber will know the risks and benefits for taking medication at this time, even though I know people feel pretty nervous about that often, which is totally understandable. But we don't talk a lot about the risks of not treating pregnancy and postpartum mental health issues, which are high. Suicide is the second leading cause of death in postpartum in the States. And so it's also risky not to treat. And for some of us, medication is going to be a really great option, especially along with the next one, which is professional support. Especially if you can find somebody that has training or experience in perinatal mental health, they're going to be able to provide you specific support around all the unique experiences of what mental health feels like when you are a parent or becoming a parent or have experienced maybe a loss. all of those things. It can be helpful to have, if you can find somebody that really understands that, but getting any kind of help is better than getting none. We talked about how important social support is. And I go to self-care last on this list because I think it should be the last one on this list. I think that we should have much more support from the people around us, because this is a time when we are feeling vulnerable. We're maybe physically unable to do the things for ourselves that we often rely on to feel really good, right? Maybe you can't go for a run anymore, or you're just not sleeping well because you have a baby that doesn't sleep well. So relying on the people around us as much as possible. This is such an important piece. And some of us have more of this than others, easy to get to. But I think that collective care is a more important thing. And I think we're missing a lot in our very individualistic culture, as an American culture, that is. And we need a lot more collective support. And so I encourage parents often to think outside of themselves, right? When we're talking about who's taking care of what in the household, especially after a baby is born, who's getting the diapers, who's making sure we have food, who's doing all of the picking up the other kid from school, thinking outside of the two of them or themselves, depending on how many parents there are, as much as you can. And getting really creative with that, right? Who can we rely on? Is there something we can pay for? Is there, if we can afford that, right? And if not, can we befriend our neighbors and invite them to support us, like anywhere and everywhere?
Sandra, is this something in, the work that you do with clients that you help them find words or strategies to ask for help? Or how would you, encourage somebody either who just had a baby, is expecting a baby, to kind of bring their support systems, maybe their partners or their spouses, to kind of show up in that social support category?
Yeah, that is a good question. And it is something that I work through, especially for those of us that aren't used to asking for help for things.
Yeah,
This
what moms?
I know. We get a lot of messaging too about how asking for help means we're somehow lacking as a mom. And we have a very gendered idea of parenting in America, and moms are supposed to be in charge of all the things, and that's what makes you a good mom. One of the things I ask clients all the time is what's a good mom then? And most of the time we're like, what is that? I actually haven't thought about that. So we talk about how it's your job to meet or make sure that your kids' needs are met, but it's not your job to meet them all yourself. So who can we
Love
ask? And we literally go through the list, like we'll write it down. Let's get a little bit more creative. And maybe we don't want to have mother-in-law here all the time, but could she be a person who runs errands, right? Like, so we talk about who do we trust with what? And then kind of how, like literally writing down a script about how we're going to talk about it and ask for that help. But I think when we really go through it, more of the time we're reluctant to ask rather than we don't know how to ask, right? So once we get past the part of like asking for help is what a really good parent does, then we go, okay, well, I actually can talk to them. It's really the belief that I have permission to do that, especially when we have anxiety showing up, where we're often feeling like controlling my kids' environment and access to them as much as possible is a protection rather than limiting us access to resources. That can be a huge barrier. So once we get past that part, we all kind of actually know who the people are around us. And if we realize we don't have enough, then we start looking even further out, right? What does this mean? Do we need to hire somebody to come, overnights, 2 nights a week? Do we need to maybe talk to that cousin that we don't usually see that often, but maybe we can use them now? We just start to get as creative as we can.
I mean, I'm still Instacarting my groceries. I started when I had littles, and now they're, in school, and never going back.
Me too.
Not sponsored by Instacart.
Yeah, I know. I had twins. And so during the twin pregnancy, I couldn't walk anymore because there was so much pain. And my husband was doing a PhD program. So like getting to the grocery store, we already had a toddler, was like, this is not happening. And I started just getting the groceries delivered. And I also have never gone back because who wants to go to the grocery store? It's a good example of like cost benefit, right? Maybe it's going to cost me a little extra for that, but it's going to save me a lot in emotional wear and tear. So let's do it.
Yeah. Love it. Okay, cool. Awesome. Thank you.
Totally. Relaxation and mindfulness techniques. I know this sounds kind of vague, and everything everywhere is like, we do mindfulness and relaxation, and it doesn't really mean anything to a lot of people anymore. So I want to break it down a little bit. When we're talking about this, we're talking about strategies to help kind of come back into body. When we talked about the trauma, we talk about anxiety and some of those other things, it really takes us out of our body. And also at this time period, our bodies we don't get ownership of our bodies completely, right? Someone else was living in them for a little while. Maybe someone else is now relying on them to be fed. And that is overwhelming. And so we can use strategies to come back into the body and feel like we have a little bit more agency back in our body. And in our IOP program, we include a yoga and mindfulness component specifically aimed at figuring out ways to incorporate this more frequently. The metaphor that I use for moms a lot is that we often think, all right, if I can just get to Saturday, then my partner will be home and I can like go to a yoga class and I'll be fine. Which is trying to like swim across the ocean without taking any breaks, right? If I just get there, and then we drown on the way because we haven't stopped and taken any time. But thinking about like going to a yoga class or trying to do something that takes up a lot of time just isn't really reasonable. So we talk about these little islands instead, right? Can you go lock yourself in the bathroom for 2 minutes and like turn on the fan so you can't hear anybody and get a sound break and do some breathing in there, or run cold water on your hands or your wrists, right? All of these really pragmatic ways to kind of come back into your body, as well as try and find ways to kind of be a little bit more regulated when we're feeling dysregulated so that we can get through what we need to get through as parents. And then we have to say self-care, because we do have to take care of ourselves. I'm just going to admit that I have such an aversion to the word self-care because it started off as a part of the Black Panthers movement as like a resistance term, that like taking care of yourself and as a marginalized person is a way to like as a political act of resistance. And now it's just a capitalist term for like buy our wellness product. And it doesn't really have a lot of meaning anymore. But I don't think we have great language to replace it yet. So in the meantime, we'll go with that. But I want to be clear, this is not buy the products to make you feel better. And we're given that a lot, right? But either how to be a good parent is to buy the right products, how to take care of ourselves is to buy the right products. And I want us to think about self-care in ways that are a lot more sustainable and are really a lot more about attuning into our own needs. So if we grew up in a house that had parents that helped us that like tuned into our needs and helped us to figure out how to cope with stuff, then we might have a good toolkit for this. Some of us did not. And trying to tune into our needs when there's so many of them and other people need things from us can be really hard. And so I think we can think about self-care as a way to separate out what my kiddos' needs are from what my needs are, and validate that nobody's needs are more important. It's just that this little kiddo person's needs are a lot more immediate and a lot more constant, but everybody's needs in the family are important. And so self-care strategies look really different for everybody, right? It might be more alone time. It might be more social time. It might be more rest. It might be something financial self-care. There's a little wheel that I use, and I should have thrown it in the slide, for the 7 different types of rest, right? There's just different areas where some of us might need more support. Maybe I want more spiritual support, or maybe I need financial support, or what are we doing? And in sessions, we try and kind of fine tune what are we needing right now, not making a plan for like the next 6 months, but like, what do I need today, the rest of this week?
Yeah, I think this wheel, I like that it says for parents, because as you were talking, again, I'm out of the baby stage. But so much of this resonates with me as a parent. I mean, especially in May, summer. But I'm like, yes, I need to do all of those things. And I remember when I did have babies, self-care was like, did I shower today? Which is like, ugh, I hate that a shower is considered self-care, but sometimes it 100% is. So anyway, I really appreciate this wheel. And I think it's super relevant for whatever age and stage your children are, or you are personally. I think these are all helpful for any kind of moment in time, personally, especially as a woman.
Totally. I could talk about that for a long time, about the experience of being a woman in America.
That's another day.
That's another presentation. Yeah, that's another presentation for sure. I think it's important to situate this whole wheel to like inside of the context that we're in, right? So I think one of the challenge, this is literally what I'm writing the book about right now, right? Is that we internalize the challenge. So we're told that if we're having a hard time, it's because we're just not doing enough self-care. You're just not trying hard enough. When really we're dealing with like a bunch of systems and the overlap of a lot of systems that aren't helping us, but are actively holding us back in some cases. And being aware of that can be really empowering, because it's not that me having awareness that like, oh, there's racism in the medical system is going to change the system overnight, but it is going to help me blame myself less for what experience I might have had there. So putting stuff in the broader context is a lot of the work that I do too, and I think is often really helpful. This is some of the specific evidence-based therapy techniques for working with perinatal clients. We already talked about the like trauma-informed yoga and movement piece. I actually did my master's thesis on this specifically for perinatal mood and anxiety disorders, and it is helpful. It improves like reduces preterm labor, it improves bonding, it reduces depression, anxiety, and trauma symptoms, lots of stuff. Specialized reproductive psychiatry, and I have a resource for that in a slide or two. So working with a prescriber that has training or experience specifically around reproductive mental health, specifically women, is really helpful, especially if you have a lot of questions or reservations or concerns. Having somebody walk you through the real cost benefit is invaluable. CBT is recommended for everything because we put a lot of research into it. So because it's an easy one to pay for. And then acceptance and commitment therapy, I also find really helpful, especially with perinatal anxiety or OCD. And then, of course, interpersonal psychotherapy, which is the kind of talking stuff through and emotional processing. And the feminist therapeutic orientation is helpful. And that just means what I was mentioning on the last slide, which is like considering all the systems that we're in, operating from a place that wants to empower you to help yourself advocate for yourself in whatever situation you're in, whether that's finding those care support team, whether that's navigating a medical system and maybe finding a different provider, whatever that looks like. That orientation can be a helpful framework for helping us to get to a place where we feel like we have a lot more agency.
Sandra, you mentioned CBT as, a lot of research, et cetera, et cetera. If there are folks on the phone that don't know what CBT stands for or what and that might look like, could you elaborate just briefly on that? Because that is a common, approach for more than just, this type of stuff.
Totally. Helpful. Thank you. Yeah. Cognitive behavioral therapy. This is what you think of when people are like, challenging unhelpful thoughts, maybe coming up with more helpful thoughts. The pieces that I use the most from cognitive behavioral therapy, because there's limitations to CBT, right? Sometimes just telling yourself to think a different thought is really not going to get you all the way there. But cognitive distortions, which is like this list of types of thoughts that are unhelpful, can be a really helpful lens for thinking about our thoughts, if that makes sense. CBT is a lot about thinking about our thoughts. So that is one component of care that can be really helpful. Was that enough there, Lindsay?
Yeah, it gives a little bit more foundational framework to it, because I think it is a phrase that gets shared often. Yeah. And so I just wanted to make sure that, we touched on it briefly.
Totally. Thank you. Let's talk about some resources. I'm going to start with ours because I'm biased. At the Center for Reproductive Mental Health, we have a couple of groups. We have a 90-minute perinatal connections group. That is 11:30 to 1 on Mondays. That is telehealth. And then we are starting our 9-hour-a-week intensive outpatient program, which is Tuesdays through Thursdays. That's 9 to 12, also telehealth. And this is our current team, Maria, Holly, and Julie. All specialize in perinatal care. Julie has extra expertise in perimenopause and menopausal mental health, which we're excited about. Currently, Maria and I are running the Monday group, but you'll see all of the team in all of those groups. And the components of that therapy is all like group discussion. We have the yoga group on Thursdays, and all of the curriculum is some of that acceptance and commitment therapy, talking about like attachment, bonding, relationships, the mental load. We go over all this PMAD stuff that I just talked us through today. And the group is so great and so fun. And that's my commercial for it because I love it.
And I put in the links. So on the bottom of the screen, you might see like a little box that says links. I put a link to learn more about the Center for Reproductive Mental Health Services. So you can click that. I will also see if I can find the information about the IOPs. I think we have a flyer on the website, and I can link that here as well. So you've got it as you were just kind of talking about that. So awesome.
Thank you. Yeah, this is the website here. So you can also do that. This is the number for the clinic. So I'll leave it up for a second in case you want that QR code. I love a good QR code. So I've got more coming. All right. This is from the, oops, let me go back for a second. Sorry. This is from the Minnesota's like the state, the health department's website, specifically for perinatal mental health. And they have like the suicide crisis line on here. This is that. But the one I want to highlight here is the National Maternal Mental Health Hotline, which is this number here. I think you can text it as well. I'm doubting myself for some reason, but I think you can text, and definitely you can call, and they have English and Spanish speaking providers on the other end of that line, which is awesome. And we just fought with Congress to get some more funding for this hotline. So it's still up and running, which is great. This is the rest of their stuff. This lists more community resources. So Red Leaf Center for Family Healing, I want to highlight on here because they have a perinatal psychiatry outpatient program. So they provide some things that we don't have in-house here. They have a partial hospitalization program. So that is 6 hours a day, I think, for 4 days a week. So that's for a much higher level of care. For folks who need that, I refer out there. And they have an outpatient perinatal psychiatry where they have specific prescribers that are perinatal mental health focused, and they are wonderful, and we have a great relationship, and I've never sent anybody over there that has told me anything bad about it. The other place I want to point out is Postpartum Support International. If you are not familiar, they are a international, I guess, resource that has a ton of good stuff on there. So they have a directory for perinatal providers that is nationwide. So you can go and look in your area for an IOP like ours. Ours is listed on there now, or individual providers that have the training or the certification that we have here. They also have, here's a website here. They also have free online support groups that are really specific to a lot of different parenting experiences. So there's one that's they're all peer-led. And they're trained. I used to lead a loss one for about a year before I took this job and didn't have time anymore. But they are 90 minutes each. They have pregnancy and infant loss support groups. They have after abortion or therapeutic termination groups. And they have perinatal mental health groups. And they're really specific. So they have like Black moms group, mothers of multiples, moms with ADHD, parents, partners, like early loss, late loss, pregnancy after infertility, pregnancy after loss. I mean, it's very postpartum eating disorder support, right? So there's NICU parents. That's a great one. Dad support. Anyway, I wanted to show you what this looks like because they're really easy to get into. You don't have to register ahead of time, and you don't have to pay for them. So that is a great resource, even in addition to, and I send clients to this all the time. In addition to getting therapy, like having other peer support is a really great way to get help. And there's good evidence that those groups are helpful in reducing some of the struggle. So here's a couple of books that I love. The postpartum depression workbook we use in the IOP program and the Monday group too. Good Moms Have Scary Thoughts was those pictures in the beginning, those little like cartoons that I showed, those are from Good Moms Have Scary Thoughts. It's like a little graphic novel style book about perinatal depression and anxiety, which is great. Brave New Moms is written by Dr. Jessie Everts, who's a friend of mine and a Minnesotan. And that is about like mindfulness strategies for going through postpartum. And I use some pieces of her book in the curriculum too. I also like the pregnancy and postpartum anxiety workbook, which is great. And that uses some of that CBT strategies to look at our thoughts and help evaluate like what feels helpful and what doesn't. So those are some of my favorite resources. Oh, that's all blurry there. That's it. This is our website again, I think.
Yeah, it is. And I also, I checked it earlier. I did send a little notification if Sandra had called out our team. Obviously we've got Holly, Julie, and Maria. I put a link right there. You can go book time. I think there's even like appointments available maybe not this week, but it's Thursday, but within the next week, if you wanted to get time or share this link with your friends or family or anybody else who might be looking for support and resources, we've got them. We're here for you. And we have truly incredible clinicians who are just, incredible experts in the field. Other places will go, they'll see women who, might be expecting or new parents, but these 4 women are experts. This is what they do. This is where they shine. So 100% encourage you to check them out, grab some time. Hopefully you found this information super helpful. I see there's a chat that came in. Melissa, thank you for all you do. Have a great birthday weekend. Thank you. I will. Any other comments, questions? Otherwise, we can take 10 minutes back, go grab some lunch. But truly, I think, feel free to connect, reach out. There's just, having gone through this, I feel like white knuckled it myself before, when I had littles, there were moments in time where I would have really loved to have some resources like this. So thank you, Sandra, for all you do, for sharing this really helpful information. Happy, do we say happy Mental Health Awareness Month?
Sure.
Yeah, love it. It's a happy time. So again, thank you everybody for joining. And with that, I think we can wrap it up and have a great holiday weekend if you're doing anything. And like I said, hopefully we'll get some nice weather to
totally
kind of finally invite summer in Minnesota.
Right.
All right. Take care, everyone.
Thank you.
Thanks, Sandra.
Mm-hmm.